Discovery series. We are a global movement dedicated to ensuring everyone practices self-care. We advance self-care advocacy, evidence, practice, and learning to support people meeting their own health goals and to strengthen health systems.
The World Health Organization defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. The series has invited more than 50 organizers from around the world to share what self-care means to them in practice through 16 individual sessions. While each session examines self-care through a unique lens, they are very much connected. We encourage you to participate in as many as possible.
The Discovery series is open to everyone: advocates and activists, healthcare providers, government officials, program implementers, community members, because all of us should have a vested interest in self-care. We hope you share your own ideas and insights throughout the series and keep the conversation going by becoming a member of the Self-Care Trailblazer Group. We'd like to thank the members of the Self-Care Learning and Discovery Series Steering Committee, Advanced Family Planning, JPIGO, PATH, Population Services International, and most of all, White Ribbon Alliance. Without you, this learning opportunity would not be possible.
We also want to thank all of the session organizers who have dedicated their time voluntarily to curate this event. We should also say that each of the organizers took on the responsibility of the content in individual sessions, and so they might not necessarily reflect the views of the steering committee. Please take what you learned today and apply it to advancing policies, programs, and practices that enable self-care, universal health coverage, and your own individual health and well-being. Now, without further ado, we turn it over to today's session organizers. Thank you.
Thank you and enjoy.
Hi. Good morning, good afternoon, good evening to everyone joining. Welcome to the session in the self-care series. Today's session is called In Our Own Words, Redefining Self-Care from the Perspective of a Young Person. As you may know, tomorrow, August 12th, is International Youth Day, and we are commemorating that by discussing self-care from the perspective of young people today. This session is co-hosted by 4 organizations: HCD Exchange, YLabs, White Ribbon Alliance Kenya, and Grassroot Soccer. The HCD Exchange is a community of practice made up of individuals and organizations dedicated to advancing the use of human-centered design in adolescent sexual and reproductive health programming and policy. We convene around learning topics to curate and generate the knowledge and learning needed to advance the field of human-centered design and adolescent sexual and reproductive health based on evidence. YLabs is a global design and research organization working to improve health and economic opportunity for young people aged 10 to 24 years. Our priority areas are sexual and reproductive health, HIV, mental health, and economic opportunity. YLab's offices are based in Rwanda and the US, and they have additional staff in Kenya, Ethiopia, India, and Uganda. The White Ribbon Alliance Kenya is a people-led national movement for reproductive, maternal, newborn, and adolescent health and rights and gender justice, with a vision for all women and girls in Kenya to realize their right to quality health and well-being, and that their right to participation in shaping their healthcare is upheld. They are driven by a deep passion and commitment to reducing maternal and newborn deaths, protecting the reproductive rights of women and girls, realizing human rights, and gender equality for the marginalized and for those discriminated against. And Grassroot Soccer is an adolescent health organization that uses the power of soccer to educate, inspire, and mobilize young people to live healthier and more productive lives and be agents of change in their communities. Grassroot Soccer engages youth aged between 10 to 24 years through its sports-based skills programs and designs deep experience in positive youth development and adolescent sexual and reproductive health and rights, including HIV prevention, future planning, gender-based violence prevention, and community mobilization. We are so happy to welcome you all here today. My name is Ipsa. I am the Youth Engagement Officer at HCD Exchange, and I will be moderating today's session. Next slide, please. So the learning questions for today's session are presented on the screen. So we want to understand how young people define self-care, and we want to attempt defining self-care together with young people on this call so that we can understand what young people want included in self-care programming. We also want to understand how organizations can best enable young people to practice self-care. And finally, how can self-care reinvigorate health literacy among young people and help them raise voice again and agency to address challenges that affect their daily lives? Next slide, please. So in today's session, we will be beginning with introductions. We have a youth steering committee that is going to be leading this session today. So today's session is in honor of youth self-care, and therefore is being entirely led and organized by young members of the organizations mentioned before. We will start with talking about self-care and understanding our own interpretations of self-care. And then we'll go into a fireside chat with some of the young people from these organizations to understand their experiences and to see how they have experienced self-care themselves and how they have seen other young people practice self-care in their own communities. And then we have a very exciting breakout session activity with you all, where we will attempt to go a little bit deeper into the definitions of self-care and understand how we can use the language around self-care to do advocacy towards it, and how young people can empower themselves and other young people in their community to practice self-care for better health outcomes for everyone. And then we will end with an ally statement. So that is the discussion today. It will last approximately 90 minutes. And next slide, please. So as I already mentioned, HCD Exchange, White Ribbon Alliance Kenya, Grassroots Soccer, and YLabs are co-hosting today's session. Next slide, please. All right, let me introduce today's speakers. I am the moderator for this session. My name is Ipsa. I am a young feminist from India. I currently serve as the Youth Engagement Officer at HCD Exchange, where I facilitate meaningful engagement of a diverse group of youth advocates. I have 2 years of work experience with a youth-led organization where I worked on communications, research, and programming on comprehensive sexuality education, safe abortion, and youth-friendly health services. I'm curious about tackling systemic issues to create a more equitable world, and therefore want to study and work in public policy. And it's lovely to be with you all today. Our next speaker for today is John Maina. John Maina has worked with key populations in Kenya for over 5 years, focusing on sexual and reproductive health service delivery, behavior change communication, and empowerment of young people. He is globally conscious and curious about self-improvement, as well as improving the community around him. He is especially passionate about sexual and gender minority rights, as well as mental health advocacy. He works at an organization called HOYMAS, where he collaborates with volunteers, technical staff, donors, local and regional Ministry of Health bodies to develop and review strategic awareness campaigns, as well as deliver high quality services in line with the desires of youth and current global best practices. He's currently also acting as an associate at HCD Exchange to continue advancing learning in the impact of human-centered design on ASRH work. The next speaker for today is Patience Thembo. Patience has worked with Grassroots Soccer Zimbabwe for 7 years as a senior coach and a youth reproductive health assistant. She conducts soccer-based health activities with youth participants in her community and helps them determine which contraceptive method is suitable for them. She also links them to health services and equips them with the relevant information they need to make informed decisions. As a youth reproductive health assistant, Patience works to create an environment where crucial health-centered discussions and decisions can be made in a safe environment. From HIV testing services to family planning and contraceptive methods to sexual and gender-based violence education, she helps empower young people with the knowledge and the power they need to make informed decisions for their happier and brighter futures. Next, we have Mary DePache. Mary DePache is a trained citizen journalist and youth champion with White Ribbon Alliance Kenya, with a focus on sexual reproductive health and rights among adolescents and young people within her community in Narok County. She is a passionate girls' and women's rights advocate who spends her time organizing community conversations with young women and adolescents to capture their SRH needs, challenges, and lived experiences. Mary has been instrumental in driving local advocacy efforts targeting young people, including pushing for the implementation of the National Adolescent Sexual and Reproductive Health Policy at the subnational level as it relates to establishing comprehensive adolescent and youth-friendly health services, as well as eradicating harmful cultural practices such as female genital mutilation and child marriages. Next, we have Gary Lane from Y Labs. Gary sees the content strategy and creation for Cyber Rwanda. He develops characters, series outlines, and leads the content approval process with young people and the technical working groups within the Rwandan government. And finally, we have Susan Towett. Susan is a 2021 fellow with Grassroots Soccer, and she's currently based in Kenya. She is passionate about social impact projects and has worked on adolescent healthcare in urban slums and waste management at the Nairobi Design Institute. Most recently, she worked with Dalberg Media and Merck Group on a project to help eradicate bilharzia in Kenya. With a master's degree in human-computer interaction design from City University of London and an MBA in business information systems from Turku Schools of Economics in Finland, Susan uses her knowledge and skills to help Grassroots Soccer build a strong foundation in youth-powered design. So as you can see, we have a very strong set of individuals speaking with us today with experience from all over Sub-Saharan Africa. And we are very excited to begin the conversation with them. Next slide, please. So before we hear from our wonderful youth speakers today, we want to actually hear from you. If you have a phone around, or if you're joining from your phone, then you can join us on Slido. And we want to ask you what comes to your mind when you hear the term self-care. And the instructions to participate will be on the next slide. So next slide, please. You can join at us at slido.com. So you can enter this enter this in your browser and enter the code 737191 to join this particular meeting. Or you can scan the QR code on the top left corner of your screen as well. The instructions are also pasted in the chat below. So if you can just take a moment to log in and then respond with what comes to your mind when you hear the term self-care. And we'll have the questions, we'll have the answers popping up on the screen as people start answering it. Great, some people have already started to participate. Lovely. If you have any questions about joining or if you're facing any trouble, you can always post in the chat and someone from the team will help you. These are some great responses that are coming in. I see liberation, independence. So there's like big ideas like liberation and independence. At the same time, there's like actual practices like getting a pedicure, doing yoga. That's lovely. Autonomy seems to be coming up as a huge aspect of self-care as well as mental health. I'm so glad to see this because we do want to promote self-care not just as an element of physical health but also mental health. um, all right, I'll give a couple more minutes to people to keep entering their responses, and then and before we move to the next slide. All of this sounds great. Me time, deep self-love, I love that. um, I hope we get to discuss that in more detail in the breakout rooms, but I'm already excited by all of the responses that are coming in. All right. Um, okay, I think mental health and autonomy are the two biggest themes that are coming up. That is, maybe that's a lesson we can take with us for the rest of this call, and move to the next slide, please. Thank you, everyone, for sending us your responses. This is some great stuff. So we also want to share what the World Health Organization's definition of self-care is. So the WHO defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and to cope with illness and disability with or without the support of a healthcare provider. I think that's super essential for us to understand that self-care can happen uh, both with and without a healthcare provider. It is not necessarily one or the other. And that is why self care lies at this great intersection of individual and community as well, individual health and community health. And we'll explore that in more detail as we go forward. Next slide, please. So I, because today's session is talking about self-care for adolescents in particular, we also want to define adolescence. The definition that we all follow is the WHO definition that says adolescents are individuals between 10 and 19 years of age, and youth are 15 to 24 years of age. Young people is used as an umbrella term that covers both adolescents and youth and spans from 10 to 24 years of age. So today we will mostly be talking about self-care for adolescents, which is 10 to 19 years of age. Um, Before we move to the fireside chat, I do want to reflect on what you all have said about your definitions of self-care. I saw mental health coming in very strongly. I saw autonomy. I also saw someone mention demedicalization of certain services. And all of those things are really rich and powerful because they come from a place of understanding what self-care may mean for young people in particular. So young people lie at this very crucial intersection of um, childhood and adulthood, and therefore they're considered sometimes either too young or too old. Um, Sexual health remains a taboo in many of the countries and communities that we come from, but it becomes a more nuanced and more complex taboo at the age of adolescence and as young people, because um, many communities refuse to recognize the agency and autonomy of young people in towards their own sexual health, and yet expect them to take informed and wise decisions. And every community has their own idea of what those wise decisions are. And between all of this, young people also navigate the challenge of not having enough agency or access to resources to practice agency towards their own sexual and reproductive health, which is why I think it becomes very important to understand self care as a tool towards demonstrating independence, but also responsibility towards the community that young people can use to take control of their own sexual and reproductive health, their mental health, their overall well-being, as however they want to kind of define that well-being. So therefore, talking about self-care, particularly from the perspective of young people, becomes important and is also different from talking about self-care in general or for any other group. Of course, while talking about that, we also have to remember that young people are um, not a homogenous group, and they're not a different group. That means that many other marginalizations of identity also intersect with age, and young people are also queer, young people are also disabled, young people also come from religious minorities, young people come from refugee settings as well, and they come from many other multiple marginalizations that make self-care all the more critical, as well as all the more difficult to achieve for young people. So with that in mind, I do want to get started with the fireside chat and ask our wonderful speakers today what their experience of self-care has been in their own work. And my colleagues will share a document in the chat, which is the link to um, actually, you can paste your questions in the chat. So as and when we are discussing, if there's something that comes to your mind, if you have a particular question for a particular speaker, please don't hesitate to paste it in the chat, and we will try to take it up at the end of the session or even during the session. Um, with that, I would like to welcome all of our participants for today in the fireside chat. So again, we have John Mina, we have Patience Tembo, we have Mary DePache, we have Gary Lane, and we have Susan Towet. Can I request you all to um, unmute yourselves, say hi to everyone, and kind of show your faces as well?
Hi, everyone.
Hi, everyone.
Hi. Patience, I don't see you. Are you
Hi.
here?
Hi.
Hi, I see you now. Hi. All right, lovely. It seems that everyone is here and everyone is ready. So without further ado, let's begin with the fun stuff. So my first question to you, and you can feel free to answer. Whoever has an answer can sort of start. My first question to you is, what does self-care look like within your work? And if while answering that, you can also repeat for the audience a little bit about what you do so that they can sort of contextualize self-care that way. Who would want to start?
I can start, Ipsa.
Yes, Mike, please.
Yeah. Hi, everyone. Again, my name is John Maina. I work for HOYMAS. It's health options for young men on HIV/AIDS and STIs. So working with young MSM, especially offering sexual reproductive health services, GBV response services, and mental health services. So how self-care looks for us, and how I've seen like my peers and guys at work do self-care, it has looked like getting a pill buddy for those who are living positively, or for those who just started PrEP. That really helps with like the appearance stuff, and it's something we really recommend even when one is being initiated on medication. It also looks like attending support groups, because again, that's like a recommended part of the package for your social well-being. You've been given a diagnosis, you are struggling to like come to terms with it, and we find that that peer support is really important. And yeah, I've seen people really grow in those support groups, and sometimes they end up becoming like an income generating activity, because they live like it stops just becoming a social being when they've progressed to another level as a group. It also looks for us like making sure, like having online consultations. If you are not able to make to an appointment at the clinic, you can just make an appointment online and talk with a clinician, yeah, who is ready to also pick up a phone and even use Zoom, WhatsApp, or even text them. That's how it has looked also. Also, for some people, we've realized sometimes the regular condoms that are issued by the government, they don't feel like that encourages them to practice safe sex. Some people will be issued that and they just discard them. But when we issue things like scented condoms and nice lubricants, people really get excited and they're actually looking forward to using protection during sex. And also we've seen a situation recently where there's a preference to just use a self-test kit instead of coming all the way to the clinic if you're coming from far. And that's an option we've also availed because of the demand. Yeah, that's how it has looked at HOYMAS Ipsa.
That's awesome. So I see that for a particularly challenging SRH issue like HIV, it has become a way of like safer access to services without having to like undergo or deal with some of the challenges or some of the taboo. And self-care can also mean self-testing, and self-care can mean like being part of support groups with people that understand you better and that share that experience with you. That's lovely. That's wonderful to hear. Thanks Mina for sharing that. Anyone else who wants to kind of talk about self-care in their work?
Hello.
Hi.
Yeah, I'm Steve Kamfinda from Malawi. Yeah, so
Yes.
I just want to share the way you have asked the question. In our case, I am working with Fight AIDS Malawi as the programs officer for sexual reproductive health among young people. So in our work, basically, we do form youth clubs that basically they act as a platform whereby young people can come together to share the experiences that they have in sexual life, in relationships, and every corner of life. So they also talk about family planning methods, how to use them, where to access them. So in our case, we take the question as for they access family planning methods. That means they are in self-care concept. They are using self-care. They access family planning methods like condoms. They access family planning methods like no plant, the injection, the pills. Yeah, so those are just part of self-care approach that can be of use in our work. Yeah, so that's how I take it.
Thank you so much, Steve. I'm so glad that you are eager to participate and share your experiences. Definitely, the use of family planning services is a wonderful way that young people can sort of practice their own self-care. And if others have such similar experiences, or if they want to kind of define self-care, you can always please put it in the chat. Because we have limited time for today's session, we will be focusing the fireside chat with our lovely speakers that are representing the 4 co-hosting organizations. But that should not deter anyone from participating. Please also continue to add your own experiences in the chat as well. Going back to the panel, Mary, do you want to come in and talk about your work with young people and what self-care has meant in your community?
Yes, Ipsa. So my name is Mary Dapash from Kenya, and I work with the adolescents, their parents, and the whole community. I teach them and educate them on the adolescent sexual reproductive health. I also link the adolescents with the service providers. So they have a lot of challenges here in Kenya, like teenage pregnancies, female genital mutilation, child marriages, sexual violence, cyberbullying, even school dropout. So my experience has been just so it's been really a nice experience because teaching them, having dialogues with them is a form of self-care to them because they'll take care of themselves. Like in my community, physical and mental health is really important. And for them to avoid those challenges, they have to take care of themselves. And basically that's how it is here in Kenya. They're teaching them adolescents on reproductive health, their parents, the community, and even the community at large.
Right.
Back to you, Ipsa.
Thank you, Mary. Absolutely, you're right in saying that self care can actually be just about getting right information. I think somebody has also put in the chat that the WHO definition has is there, but what about incorrect information? And I think all the awareness, well-being, and health sort of starts at awareness and having correct information, and it's that's what is critical to understand, that self-care can sort of start at that very first step, and it does not have to be something too complex or doesn't have to like come after a certain stage. I do want to have a follow-up. I have a follow-up question for you. I want to understand if there are any particular examples that you can share with us of how young people in the community that you work with have navigated some of the challenges that you mentioned, like female genital mutilation, child marriage, some of these issues that are really complex. How does self-care provide a way to, to sort of navigate some of those larger issues?
So self-care has really helped because uh, the information on sexual reproductive health really help the adolescents to understand their bodies and also to make their own decisions about their bodies. And also it has helped on the adolescents and even parents be aware of the resources they have, like schools, churches, mentors, and professional help. And also it has really helped because the self-care really, it has helped them to be aware of the environment, like avoiding visiting risky places during the night to avoid rape. And also we have provided them with the right information, be it on social media, teaching them. So at least self-care has really helped them to know what is self-care, both physical and mental. And also it has there is discrimination with the disability, those with disabilities, with the levels of education. And so fighting that discrimination is really bringing the notion of self-care. So on the FGM part, teenage pregnancies, teaching them on how to avoid such circumstances has led to the awareness of self-care and how they can handle themselves so that they avoid those harmful cultural practices. Back to you, Ipsa.
Thanks a lot, Mary. Yeah, I see that you've kind of covered the entire scope of sort of working on complex SRH issues, right from information and awareness to like accessing health services, managing your own sexual health and health-seeking behavior, and then all the way to advocacy. And thank you for very clearly highlighting how self-care can play a role in that entire journey, all the way from awareness to access to advocacy. So now that we have understood all the ways in which that self-care can be used, um, I want to focus on what can be some of the challenges in practicing self-care. So, Gary, why don't we go to you? I want to ask you, what are some common challenges that adolescents face in accessing and practicing self-care? And how can we also help mitigate some of those challenges? And if you have any experiences from your work with Y Labs at Cyber Rwanda, please share those as well. Welcome.
Yeah, right. Thank you, Ipsa. My name is Gary, like she said, and I work at Y Labs as a content writer. I'm going to be drawing from my experience there and from my experience before. Yeah, so there are many challenges really, and of all kinds. And when you look at them, you see similarities between them, how each ties into the other, and some differences too, based on gender or age. And this is the case whether self-care is seen through the lens of health, like we've had, or seen as leisure activities or hobbies, which for me has been the most common experience. So things like culture, economic background, families present the most challenges because I believe there are external factors that most of the time young people have little or no control over. But also things like time, in the sense that except for when they're in their holidays, young people are up at 5, they go to school and they're back at 5, leaving no time for themselves. And at home, their families expect other things from them. And by the way, these expectations continue to grow as they grow older. But back to my point, families highly influence the choices that we young people make. And it can be really limiting to a point. You go to the culture and society, and self-care is not really seen as something that is good for young people, that it is not part of the culture. So there is this belief that should young people be given the time and the opportunity to practice self-care, they are going to turn into hooligans and embarrass themselves and their families. So then how do you mitigate these challenges? It's really going to depend on what role you're playing in a young person's life. But first, give us freedom to explore and make mistakes. I mean, of course, some mistakes should be avoidable, but some mistakes have to be made to grow up. And parents especially tend to think that if their children aren't exposed to this or that they won't lose their ways, that they will lose their ways if they're exposed to these things, to self-care, however you might define it. And of course, their fears are not unfounded. But I guess what I'm saying is, how do you find that balance? And if you're not a parent, find a way to engage parents, caretakers, caregivers, people who have a say in what young people see, in what they access. It could even be ministries of health, of youth. And then also empower young people. You know, I don't particularly like the word empower because it's just so cliche. It sounds so cliche to me. But what I mean is, if you have a product or a project, how do you make sure that young people see it as theirs, as their right, their responsibility? How do you involve them, not just in the execution, but also in the creation process? So that's what I think you could do to mitigate those challenges. Thank you.
Oh, thank you, Gary. So many relevant and poignant points there. For sure, I think the biggest challenge with self-care, but also with young people exercising agency in general, is that they are overstepping, or they are going to they're sort of losing control, or they're expected to they're not given control of a lot of things and yet expected to be in control at the same time. And I think that is what is the particularly precarious nature sort of being in this age of adolescence and youth. I like what you said there about self-care. Kind of, we think of self-care as like an individual, or as being selfish, or an individual being um, too worried just about themselves. But it is not that. In fact, it is a community responsibility. There so many decision makers that exist within the ecosystem around young people have a role to play in enabling. Empowering may be a cliched word. Maybe enabling is what we can use. How do we create an enabling environment for self-care? um, but going back on this sort of discussion between whether self-care is like is limited to the individual, or it is a community responsibility, and how much of it can be dictated by the community, and how much of it should be sort of the responsibility and the agency of the young person themselves. That brings me to my next question, actually, which I want to pose to Patience. Patience, what do you think about how young people can manage self-care independently? Are there any examples of that from your work that you would like to share?
All right. Thank you so much, Ipsa. All right. What I can say is that prior to the COVID-19 pandemic, an inadequate access to adolescent-friendly health information and services, due to stigma, logistical reasons, and how equitable gender normality, it has continued presenting a challenge in meeting sexual reproductive health needs of young people, most particularly for girls and young women. And with the pandemic spreading rapidly, we witnessed how adolescents were further excluded from gaining access to the severely stretched health systems. So with us here at Grassroots Soccer Zimbabwe, there was an introduction, a program that was introduced, which is the Youth Reproductive Health Assistance, where we work within our respective communities, engaging with our participants or clients within those same communities, where we tend to give them support, much needed support, making sure that we escort them to health facilities. And then we also impart to them information, important sexual reproductive health information to them, so that they are able to make a choice. So I can say that this contributes greatly to the self-care notion that as a person you are able to make choices, you are able to self-diagnose yourself. Just look at yourself, and if you feel like some sort of way, you just know that, okay, if I feel like this definitely means that I have to go and seek further help from a health facility. And seeing how all of these health facilities are crowded right now, I think this has quite helped us a lot, like as the YRHAs, to be able to assist those who are in need. So through the YRHA program, participants have received multiple benefits of self-care interventions for sexual reproductive health rights and information, and also services, including reduced exposure to stigma and discrimination which they face from, nurses. Those people, they tend to be judgmental, especially when you are coming to seek critical health services. And Also, there's also increased confidentiality, empowerment, self-confidence, and also informed decision making. And also, there are notable concerns which include insufficient knowledge. Like when you've noticed that someone has got insufficient knowledge, that's when you impart the information that you have onto them, and making sure that they know the right steps to take.
Absolutely. Yeah, thanks, Patience. That was a really good explanation and overview of how doing little things can like sensitizing the healthcare workers, or even escorting someone to a clinic and giving them the correct information about their sexual and reproductive health can be such a huge enabler of young people practicing self-care. And if all of us are enabled and empowered and encouraged to practice our own self-care, then that kind of becomes a step towards achieving not just our own well-being, but community health and community well-being. So thank you so much for touching upon that as well. I think we've seen um, how self-care is relevant and important at all parts of the journey as an individual goes through the health system, but also what are the factors and who are the people that can help enable young people to practice self-care. And most of all, it is people like you all, like Patience, Gary, Mina, Mary, who are able to help other young people sort of realize how important self-care can be. I see there are a lot of questions in the chat, so maybe we can start kind of addressing those. So we have a question for Gary around what have you seen work well to engage caregivers and parents? And then there is another question around, is it right for parents to direct their wards as seen in the African setting? So Gary, if you can sort of answer both of those together with positive examples of parents enabling young people to practice self-care.
Yeah, sure. And thank you, Megan, for asking that. Right, so I'm going to draw from my experience at Y Labs. We've been working with caregivers, and it's been really successful, I would say, so I want to draw from that. And so what we do is, first of all, especially when it comes to going on the ground, if you are just starting out, people don't know who you are. And so it goes to say that they don't trust you. So you have to find partners that are already in the communities and who are trusted. And after doing that, if let's say you want to say, let's say, or you are bringing up something that is likely to cause some mistrust or some questions, like maybe use of long-term contraceptives, which you're currently doing, you don't have to first of all take it to young people. So what do you think about it? Hear their thoughts, and then when you have what they say, when you have the facts of what it is like for young people, then you approach the caretakers or even people that are going to approve what you're trying to put out. Again, like I said, it could be people from ministries, which we work a lot with, and you have to do that right from the beginning for them to feel like they are having a say in what you're doing, because again, you're not doing this in your community, you're doing this in their community that they're in charge of. So they have to feel and see that they are also participating in how their communities are changed or how they're being impacted. And so you have to do that right from the beginning also. And when they raise questions about some stuff and they're reluctant to accept what you're trying to propose, it's important to also go back then to what young people said and come and show them what young people's lives are like. And that is likely to really change their mindsets on on what they're reluctant on about. I hope I've answered your question. If not, just put it in the chat again. And then I think the other one is from Zakira. I hope I'm pronouncing your name well. Could I have a clarification on what you mean when you say direct their words? I'm not familiar with the term.
I think it means more around like dictating what is good and bad for their children. Yeah, right. Okay. So in that case, then parents have a role to play, and the big one of that, and it's important that they play it, and that is to help young people, especially adolescents, navigate the teenage years, which are really not easy. But it is also crucial not to know when to where to stop, where not to be overbearing, and when to let young people also exercise their own choices. So I would say, don't go full-blown dictatorship and tell them what they have to do and what they don't have to do, and be really strict with them. Just allow for that conversation to happen with them, and listen to them, and you'll see young people are going to surprise you. They have surprised me at times too. So yeah, just try that. Open the space. That is great advice. Thank you, Gary. I see some claps for you also in the reactions and some thumbs up. We'll probably take one more question. And I know there are many questions that we probably don't have time to answer, but I'll try to get to as many of them as I can. So there's a question around, interesting. There's a question around systems, which is it the responsibility of health facility to finance self-care or to encourage it? And then what is the cost of corruption on self-care? So really talking about like systems and resources. If I can request all of the panelists to have a go at that question in the chat while I ask Maina this question from Easter, which is, how do we engage through an intersectional lens to ensure services for adolescents who identify as LGBTQI, and how do health facilities finance self-care at the grassroots? And then there's also questions around PrEP and stigma, and how do the parents receive intervention, especially the lady that works with both parents and youth. I think that's a very precarious situation, but one that is very common in our communities. Often the healthcare worker is the same, who is serving both everyone in the community. That includes parents and youth. So how, I guess we'll put it into one question of how do queer youth or LGBTQI youth navigate some of these challenges through self-care?
So thank you, Ipsa. I think that's a really good question. And it takes me back to what we were saying. I think someone was saying about it starts with finding the right information. And for LGBT folks, you find the information yes, it's on the internet somewhere, but some of us have to go for 3, 4, 5 years without actually getting the right information. So you may Google like to learn about who you are as a person, but it may not, the search answers that you'll find, they may not be directing you to what exactly you wanted to find. Like, what's the nearest health facility that serves like LGBT folks? You may be even afraid of searching that, or like the organization themselves may not have put themselves that publicly, again, because of like the fear of backlash for like running queer websites or running queer pages on Facebook, which sometimes happens. And I think for me, what I've seen really work is, for one, is like finding people where they are. Yeah, so we may not just target LGBT folk by just doing like a Facebook post on a regular page. For us, it has gone to the extent of like targeting the ads directly to like people who've searched LGBT stuff. They may not even know that they are risk for maybe acquiring like an infection is significantly higher. So they may not be like actively seeking out this health information or like these health services. So I think one is getting that information out there and in a very targeted way that that doesn't even put them at risk. So like when you're even suggesting, a platform to go with, you may use like Grindr, you may use a dating app where you know this person just uses this app when they are alone. So the chance for them, maybe for someone walking in and finding them looking up LGBT stuff, that's unlikely. Yeah, so for one is really finding people where they are. And then what I've seen that maybe has not been a smart way of approaching LGBT youth is this requirement for always coming to the facilities. We always want people to come to the facilities, and sometimes these facilities end up like getting known around that community. So by the fact that you're walking to this clinic, you are literally outing yourself. Yeah, and it's really, it's a really thin line to walk, because sometimes like some donors will advise us, you can situate your facility near another facility so that it doesn't look very conspicuous. And it's a good workaround, but it won't work for like all facilities. Sometimes there are other factors to consider when choosing like a location. So I think, and I've really liked the sort of migration to like, like telehealth, a bit of telehealth. So really utilizing digital platforms to do consultations, like consultations that don't need like a clinician or a healthcare provider, literally like looking at your body or taking up any vitals. I've seen that really open up people to seek services. And then also, I think I would want to add, for LGBT people, the privacy and confidentiality, it's really a priority. So anytime I see a situation where it looks like maybe I see someone taking photos in these facilities, I see your Facebook activity has like photos of people coming to your facility, again, you're shunning me because I may not necessarily be out. So we want to consider also that not everyone is, a very small percentage is out. So we want to also program with that in mind. People don't want to just be known as queer. And some people really have a problem with being identified that way. But at the end of the day, you have to like get services to them. So that creativity of making people not have to come to the DIC. And I think that's a smart way. And for us, the self-test kits, I can say the preference is like 85% for people preferring to get the self-test kit. Again, it's like 15% for people preferring to come to the clinic. So it's a huge paradigm shift for us, yeah? And now we have to move forward with that knowledge. I think I can touch a bit on how like facilities can sort of finance self-care. I personally, I do online therapy personally, and I've been like an advocate of this to like all my friends in my circles, because I used to really miss my appointments, like my physical appointments. But now that it's online, I've been doing it like consistently. So I think if I know sometimes people really have to come for physical appointments, and like that's we can't like dispute that. Sometimes it's necessary, like when you're being initiated on medication, when you're maybe doing a confirmatory test, we know some of those things have to happen. But for these services, again, that don't require you coming physically, I think facilities can start thinking around how they can decentralize that. And I saw someone also say about demedicalizing like therapies and treatment, which really falls in that line for me. Yes, so that's it.
Thank you so much, Maina, for that really well thought through response. I think you've given us a lot to unpack. which is great. And maybe we can start unpacking this in some of the breakout rooms. We've everyone, all the panelists have shared some incredible insight on um, the self-care for adolescents from many different perspectives. And I think we now also want to hear from the 97 participants on this call, what they think about self-care, what have some of the successes and some of the challenges been in their experiences, and how we can sort of collectively define self-care for ourselves and use that language to do advocacy at a larger stage. So I my colleagues will be dividing us into breakout rooms. So please select join breakout room option when you're prompted on your screen, and the youth steering committee members who you just heard from will be facilitating those breakout rooms, and where you will get a chance to sort of share in more detail your own experiences around self-care. So we will meet back in what was supposed to be 1 hour, but I think now is limited to maybe 50 or 45 minutes. So we'll meet in 45 minutes and discuss some more. All right, I'll see you in the breakout rooms then.
Hello? Hello?
Hey, Radhika, we
Can I continue? Okay. So we do have like youth information education corner at a school and youth clubs at the community. So young people can get information from there also. And then we have like different approaches, like girls and boys groups, different stakeholders are working on that. And there is a series of session on, especially on SRHR, ASRH, they used to gather in one places once a week or somewhere twice a week, and they discuss on that curriculum. There is a systematic, transformation, different, like if we talk about the UNEP, there is a transformation, and some other stakeholders, others are also have their own packages for the young people, self-help care. So direct face-to-face discussion in a small group, somewhere mixed group, somewhere boys only, somewhere girls only, and somewhere some session with the mixed group and some session with the separate groups. So that is also going on in Nepal. And then as friend said, that social media, that is one of the very best platform at this moment. And then like from the government side, social media, including private sector, government side, all are working on that. And not only social media, like national television, national radio, different FM, these groups are also integrating this self-care for the young peoples. And we do have a different mobile application, apps, where like quiz session, they can put on the questions there, in a series of it. That is also going on for the self-care, especially for the SRHR, mental health and ASRH. And then we do have a hotline services for, before COVID and during COVID also. And in terms of language, like English is international language, so many young people are aware of that, and Nepalese language, and some like in provincial level there is a different specific language like Bhojpuri, Maithili. All these languages are also using to provide information regarding self-care, SRHR and ASRH for young people. Thank you.
Thanks, Radhika. We are back in the plenary now. Unfortunately, breakout sessions are over. Love the enthusiasm that everyone has, but we also do want to make sure that we are able to wrap up on time. So thanks everyone for sharing out your ideas in the breakout rooms. I'm sure they were a delight to be a part of. I know that my breakout room was. We got some really interesting ideas coming out from that discussion. So I actually want to now use maybe 15 minutes or so, just doing a share out of some of the key points that came out of each breakout room. So I would request the facilitators of the breakout rooms to just kind of very quickly summarize what they discussed, or not even summarize, just come up with 2 points that really stood out to them from their breakout room. And why don't we start with patience? Hi, Patience. Are you still on the call? All right, then can Gary start, and then we'll come back to Patience.
Yeah, sure. Thank you, Ipsa. So again, I'm going to start with the last question that was asked about ways young people can receive information about self-care, and we've seen that using social media and especially relying on video could be the best way to really catch the attention of young people. And yeah, I think that's like the biggest takeaway from the question about how young people can receive self-care information about it. And we've also heard that I was really happy to see us actually getting to define self-care and not just see it as something that is related to health only, or to SRH only, or to mental health only. We've also seen that, but we've also seen that it can be something that that's about that is about taking care of yourself, taking a break when you need to take it. And I think someone really brought up a point about allowing young people to really take control of their lives and not always trying to make decisions for them, but giving them the opportunity to take control. Yeah, and I think those are the biggest points that came up from my group.
Wonderful. Thanks a lot, Gary. Mary, can we go to you next?
Yes, thank you so much. So from our breakout room, Joanne is going to tell us our points. Joanne?
Thanks, Mary. From our breakout session, what stood out for us most is especially when the young adolescents or the young people, when they are asking for self-care or demanding or asking for help, trust and confidence is important, and especially in terms of privacy. And also the young people there in the group suggested communication is very key. How do we now learn to communicate, to be it the peers and also to the parents? And another thing that stood out for us is the kind of language, when especially engaging the community, what kind of language do we use so that we can also have like more of euphemism? Some preferred the local language, some preferred English, especially when we are talking to the elderly on matters of sexual reproductive health, the kind of to be very also careful on the type of language that we're using. Thank you.
That is great. Thanks, Joanne. I love the point around like being careful around the language that we are using, and perhaps even considering euphemisms for issues that are particularly taboo. All right, maybe Maina can go next, and we can check if Patience is back.
Yeah, thanks, Ipsa. It was a really interesting session in our breakout room. And I think the first thing that stood out for me was in continuation of what we were saying, you know, like adolescents are really diverse, they have diverse needs. We come from very different like experiences, and that is also like our approach to self-care. It cannot be something universal. So we had some points like pointing towards like disabled adolescents, how they may have different needs. Again, echoing the language issue that also came out in our breakout room, and then adolescents having different priorities. Again, they'll approach self-care differently. And a really strong difference that came out was that we weren't even considering some adolescents are actually, they're actually mothers, they're actually parents themselves. And the challenge that comes with that is not something that maybe we have even considered when we were just considering an adolescent who may be in school, living with their parents. So we've seen this side where there's an adolescent who actually is responsible for other people in their household, which was really interesting. And then we talked a bit about, there's a conversation about like systemic barriers as well. Like when we are approaching self-care, I know some of the questions were really like day-to-day life and like activities, things you do, but then we also noticed there's this other level that definitely affects how we interpret self-care, how we deliver it in our facilities, how we program for it, which is that there's definitely a level of control that is beyond us, like through the government, if they don't support some of these self-care initiatives that we might have in our proposals, in our budgets, like they're the first to be blacked out. And of course, it's not motivating, and it definitely leaves a hole in how you're implementing your program. And again, if just echoing on that system issue, if the providers themselves, say in a facility, in an organization, are not like super familiar with these self-care needs that we are talking about here, it may not get to like our target populations the right way. Because if I don't really own the notion of I need to take care of myself, I need to put boundaries, then I can't be able to like teach it on a day-to-day basis to people who depend on me to do that. Yeah, so for me, it's that's what stood out.
That is those are all really good points, and I do have some thoughts around that, but I will first invite Patience to share what was discussed in her room, and then we can go towards the closing. Patience, are you around?
Oh yes, thank you so much, Ipsa. So in our room, we had conversations whereby we were talking about what do young people want to have conversations about, and how do they want to receive information about self-care, and which languages do they prefer or want to use, of which we got quite large amount of responses, like we say that they are able to communicate through their peers, also using various forms of messaging, whether it's text messages or WhatsApp, and also they came out a point where there's through self-care educative movies. And also we also discussed about the simple languages and the familiar vernaculars that people can use when you are addressing issues concerning sexual reproductive health rights and information. And you find that most of these young people, they prefer a language which is just direct and straight to the point. And also we also spoke about how there's also the use of social media, since most young people, they are now conversing more and more on these platforms, and that's where they tend to share more of the stuff. And I would also like to hand over to Sandra, who's going to assist me with some of the responses that we received from the other guys. Thank you.
Thanks, Patience. But she's covered most of it. I think the only thing that I'm going to add is when talking about, first of all, self-care needs to young people, a lot of participants mentioned like normal tasks like waking up early, working out, connecting with friends when faced with challenges. So self-care is really not a complicated thing. It's it can be seen and manifested in normal practice. And something interesting that also young people say was, the participants said was a key barrier and challenge when practicing self-care is just the fact that young people, self-care is about making decisions, but the fact that young people are not even expected to make decisions for themselves already stands as a big barrier to practicing self-care. In addition to the stigma around certain issues that affect young people, like sexual health, and just the fact that self-care is not widely known, given the term self-care is not widely known in practice. So that makes it a very big barrier. And then finally, one way of advocating for self-care that was shared by participants was doing your own research, find information where it is, and really getting yourself knowledgeable about your rights as a young person, the services that are around you, the resources that are around you, and starting from there. It's never that complicated. Thank you.
Thank you so much, Sandra and Patience, for sharing what came out of your breakout room. And Susan, would you like to now share what came out of your room?
Oh my gosh, I'm so sorry. I'm so sorry. The electrical wire is just going. I don't know what's happening outside. There's a loud sound, and I'm not so sure. I have to go and check it before.
Okay.
Give me a second, please. 1 minute.
Please do. Yeah, safety first. Practice your self-care, Susan. Can I request who was in the room with Susan, whoever was co-facilitating with her, to share out some key learnings?
Sure. Hi, Ipsa. This is Hannah. So I think a lot of what has already been shared was also found to be the case in our breakout as well. But just to echo, I think, key to what we've talked about was making sure that there are designated spaces, or, really to promote youth-friendly environments for young people to safely participate and engage in conversations around their own self-care, for them not to be fearful or judged about what others might think. And similarly,
sorry, Anna, can I interrupt you for a minute?
Sure.
I have to leave the house. There's smoke on the electrical transformer, so I have to leave the house right now. You can access the closing notes in the document that I shared with you, and maybe you can just do that. I have to leave. Sorry. Thank you so much for everyone. Bye.
Oh, be careful, Susan. Yeah, absolutely. And I hope Susan's okay. And just to quickly close up here, I think the other thing was just making sure that the language that is used during these discussions around self-care is in a language and conversation that is, in the terms that young people prefer to use, and, using lay terms to discuss topics around self-care. So nothing that I don't think has already been shared. So thanks so much.
All right, thanks a lot, Hannah. And to Susan as well for facilitating and coordinating the room despite this emergency, and I hope that she's okay. So I do have what Susan wanted to say as closing, so we won't miss out on that for sure. I think if I were to quickly summarize the points that are coming out of this discussion, I think what comes out most strongly is that self-care, to be able to truly facilitate and enable self-care, we first have to inform young people about not just their sexual health and not just whatever they need to know to keep themselves healthy and safe and well, but also inform them about self-care as a tool to exercise their right to health almost, and to really establish this as something that is not selfish, that is not going beyond what is permitted or what is seen as okay. and self-care can be normalized, and also not expecting young people to kind of uh, not expecting young people to navigate precarious situations or get into really situations that may compromise their safety, but rather meeting them where they are, speaking in the language that they understand, and also um, as adults supporting them in whatever way we can to exercise their own agency over their health. And I think mostly what came out of today's discussion was how adults and allies can support young people exercising self-care. And I am so glad that we were able to cover that as well. And in closing, that's what we wanted to actually offer, is a perspective on how young people, uh, how adults and allies can support self-care practice for young people. And this is from Susan, but just imagine for a second that I'm Susan and I'm reading this out. So I think today's session, we learned that self-care is all about you meaning the young person. Life can be stressful sometimes, and you need to know that first and foremost, self-care is not selfish, it is necessary. Even as a young person, it is important to not run on empty, but rather make sure that you're looking out for and caring for yourself. And if you ever find yourself in a situation where you feel stressed out or anxious, say, for example, being forced to be in an early child marriage, having unplanned and unwanted pregnancy, experiencing gender based violence, learning your HIV or STI status, or whatever the situation is, know that help is available. There are guidance and counselors available at schools, as many of you have already mentioned. Healthcare professionals also are available at healthcare centers and at youth-friendly centers and corners. Parents and trusted relatives can also be consulted and are willing to help and support you with whatever you need, depending on the situation. We also have digital interventions now that can help you take care of yourself. um, I'm saying all this, or Susan is saying all this, so that you know that you're never alone. Help is always available, and you just need to ask for it. Therefore, I strongly urge all of you young people to check in with yourself from time to time and practice self care consistently, regularly, and with purpose. In fact, I know you're all very busy people, so I want you to go out of your way and schedule self care on your to do list right now. With that said, if you're having a hard time taking care of yourself for any reason, try to find a youth-friendly health center near you and book an appointment with one of the medical or mental health care providers. They can help you figure out strategies for taking care of your body and emotional health in a way that works for you. Um, Thanks so much for your presence and participation here today, and I wish you all the best as we celebrate International Youth Day. So that's our closing statement from Susan, and I hope that that has given all of you adults in the room some advice or some guidance on what kind of language can motivate self-care use among young people. Thank you so much for sticking around in this session, and thank you so much for your valuable insight that you have provided with us with today. Please don't forget to fill out the survey or the feedback form in the chat. And thanks a lot, everyone. Have a wonderful day and a wonderful International Youth Day tomorrow.